Information technology gives doctors special ways of seeing. This man died 27 times in one day. Now a computerized pacemaker has given him a new lease of life.
Feeling off colour this morning? Sore throat? Bad back? Worried it might be something worse? Well, the first place you'd go for help is your GP.
This is the symptom of an interesting condition in the body of the medical profession, a growing interest in information technology.
Mr. Green, 9:30.
Mr. Green, first half of the alphabet. His notes are already on the computer. Now, there are more than 50 million people in this country. That's a potential 50 million clients for our health services. 50 million patients' notes.
The sheer quantity of medical care in our society is staggering. Take a town the size of Sheffield. 500,000 people are served by some 250 GPs. Every year, each doctor actually comes into contact with his patients about 10,000 times. For the city as a whole, that adds up to 2.5 million consultations a year. A single group practice may have to cope with up to 15,000 people, and that is a lot of records and notes to have to look after.
What better than to store them on computer? It saves time and space. Now, in this surgery, they're about halfway through putting all the files and notes into the computer. It's true there has to be an initial outlay in money and time to get the system working, but the benefits in terms of patient care and research are well worth the efforts. In Sheffield, Professor Wilkes has been looking into the benefits of the computer for GPs and their patients.
I think one of the great gifts of the computer is its flexibility. It can give the doctor, to a limited degree, but not all that limited, what he wants. And it is the practices in primary care who will have to decide what they want from the computer. And here I think we can divide the gifts of the computer into the housekeeping, so that the GP, for example, can have, for the first time, a really accurate and up-to-date register of the age and sex of all the patients for whom he's responsible, or those especially at risk, the babies, the old ones. And this will give him some opportunities to look at the practice population entrusted to him. And this will lead on to the second great gift that lies within his grasp if he uses the computer, and that is he will be able to look at those problems in his practice population that need surveillance from year to year or even decade to decade. Patients with elevated blood pressure, the diabetic, the asthmatic, the epileptic. These are conditions that we can control, but we need to audit our control. See if we're doing what we think we're doing, what we want to do. And here the computer can be a tremendous and valuable ally.
And using security codes, all the information on the computer can be kept as secret as any patient or doctor could wish. Far safer, at least, than the old-fashioned filing cabinets, anyway. Mr. Green, please. Consulting room on the right.
Doctors have special ways of seeing. Part of a doctor's skill is pattern recognition. Just as a shepherd knows his sheep, an art critic can identify a Rembrandt, or a cook can name the herb in the middle of a stew, so a doctor can spot the characteristic pattern of many illnesses. Even the way a patient indicates an area of pain, whether he uses the palm of his hand or points with a finger, can tell the doctor quite a lot.
Looking a bit yellow this morning is Mr. Green. Jaundice. But there are times when the pattern isn't so clear, even to a doctor, which of course I'm not. Human beings aren't computers, and it can be difficult to sort out their complaints logically. They may have several things wrong at once, each contributing to a whole brand tub of symptoms. No use the doctor making a lucky dip. He has to make an educated guess at what's wrong, weigh up the probabilities. Now, a computer isn't a human being. Don't ask it to be inspired, but give it the facts, and it's superb at calculating odds. So at Glasgow University, the computer is being developed as a diagnostic aid by a team of researchers including Dr. Robin Mill-Jones.
The general practitioner, when he's faced with a patient, has many things to decide about that patient, particularly if he comes with a symptom such as headache or dyspepsia. And what we've been trying to do with our computers and our statistical methods is to try to improve the diagnosis that people make when they see the patient for the first or perhaps the second time. And we do this by doing a careful study in which we collect a lot of information from a lot of people with, for example, headache. We find out what is wrong with them. And when we've got all this information together, then we are in a position to use it to improve our diagnosis of the very next patient who comes into our room. The kind of thing that the computer aid produces is rather like a betting slip. It has a list of diagnoses rather than horses, and each diagnosis has the odds for it. And if something comes up with odds which are very high, then if you're a doctor, you'd be certainly take notice of it and think that might be the best diagnosis you could make. So it's just like betting, really. The only thing is that the computer has one thing different, and that is we know how accurate it is, and that is at least as accurate as the experts. The other aspect of computer aids in general practice is that what one is doing very often is to collect the data in some kind of expert centre, or perhaps in many centres, even in different countries, and then bring it into one practice so that the diagnosis of individual patients may therefore be improved. We don't see this in any way as replacing the doctor. It is really just another test. But the important thing is that it is a test which he can do in his own surgery, which is in fact very cheap too.
And information technology can now help chemists in their search for new drugs.
In order for an organic chemist to make molecules which will interact with biological systems, he must have a good idea of the shape of the compounds he's making, and also try to get an idea of the shape of the systems with which he wishes them to interact. Since the war, the chemists in this country and elsewhere have made great use of stick models rather like these, which are very convenient to prepare and which can be bent around and moulded into almost any shape one might wish. These provide a very good representation of the shape of some molecules, but with very floppy molecules like this, ATP, which is a very important, indeed essential constituent of all living cells, as you can see, the whole thing is rather floppy and it flails about all over the place. Thus, if I want to get an idea of the shape of this molecule in a particular situation, I'll have some problems because it just will not keep still. Now that sophisticated computer representations are available to us, we can make a model of a molecule like this inside the computer using all the sophisticated facilities the computer provides for display and calculation. Once the computer model has been set up, we can manipulate it in any way we require. It can be rotated around, or parts of the molecule can be spun around in a controlled manner and not in the rather random fashion that I'm doing it now. Furthermore, we can use the computer to break bonds, in fact to take parts of the molecule apart, throw them away, or indeed see how the different bits interact with each other as a reaction will proceed. It's our hope that these techniques will, in the future, enable us to develop more efficient and even safer drugs than we have today. And from our point of view, it would also help if they enabled us to reduce the time and effort required in research and development.
Mr. Pink, looking a bit pale today, complaining of pains in the stomach, dyspepsia, quite common. Let's assume it's been diagnosed as an ulcer. What can the doctor do about it? Well, if he's in any doubt, one of the first things he can do is look it up on Doctor's View Data. This set is registered as a doctor's set, and so is allowed access to medical information. All the pages are free, you just have to pay the phone bill. On this new View Data service, by courtesy of Glaxo and the British Medical Journal, the doctor can get instant access to case studies, which he can then follow through. As in, for example, the story of Miss Carpenter, let's call her, going to a mass X-ray and showing a slight abnormality. What was the cause? The service doesn't tell the doctor, it asks him to test himself and then tells him what a consultant thought was the answer. The service also carries information on new drugs, how to prescribe them, any side effects, anything else the doctor needs to know. Through the Prestel gateway system, it's also now possible to link a home television set with a mainframe computer. So advanced research, like that of the Glasgow project, for example, could soon be at the fingertips of the ordinary GP. And when a new drug comes on the market, he'll certainly know what it can do instantly.
Mr. Pink would have haired off with his prescription to his local chemist. If it's half as efficient as this one, his order would be handled by computer.
These neat little microcomputers have been supplied by a Cheshire-based pharmaceutical wholesaler who wants to make it easier and more efficient for the pharmacies to handle orders and keep tighter stock control for themselves.
Hello, Park Pharmacy?
It's Street here. Are you ready for your link now?
Yeah, we're ready to go.
Fine, thank you. Bye-bye.
The micros send the orders in automatically over the phone to be processed by the company's central computer. So there's no problem of a fuzzy line confusing, say, Predsol with Prednisol. And the orders can be processed in no time at all. When there are 10,000 different items and orders have to be delivered 4 times a day, the new technology can be an enormous bonus.
If you want something that will really penetrate, something like Calmurid with urea.
The high street pharmacy is an important part of the health service. Many people come for advice on medical matters, perhaps because they don't want to trouble the busy doctor.
I mean, feel like it's so dry. It's like sandpaper.
What did you say?
It's Ativan.
Ativan. One.
Each order leaves the stockroom with these orange-coded labels. All the pharmacist needs to do to replace anything is to dial in a code. The computer prints out a clear label for the prescription and adds warnings like "Don't take with alcohol," which takes responsibility from the pharmacist and is reassuring for the public. The new system is so efficient that from order to dispatch can be as little as 15 minutes.
$50 million people, 50 million notes, and a new person born every 45 seconds. Next year's citizens are important even before they're born.
In antenatal clinics, mothers can now give the computer all their important and intimate details before they see the midwife. This friendly and reassuring Mickey programme was written by Dr. Fordry of St James in Leeds.
In antenatal care, we ask a vast number of very simple questions. And it seemed to me an area, therefore, where particularly computerized interviewing could be useful.
It's obviously a very powerful tool. How do you see its potential being developed?
In 2 ways. Firstly, to actually analyse which questions are worth asking, and secondly, there is a great potential to put antenatal care back into the community. We've been trying to do this ever since 1948, and the whole trend has been the opposite direction. With a computer in the local GP surgery, there's no reason why the standards should not be raised at the same time as going back to the local area.
There you go. Good lad. This baby was a premature baby, and we're doing this simple test to check on his breathing. And now we're going to have a look at the pattern of flow through this baby's airways. This portion of the graph represents the baby breathing in, and this portion represents him breathing out. As you can see, it's a fairly straight line with no big loops, which is what we would expect from a completely normal baby. Now I can show you a pattern we got from a baby earlier this week who was very abnormal. And this is his pattern. You can see that as he's breathing in, he doesn't have much problem. He's got a straight portion, just like today's baby. But when he comes to breathe out, he has this big loop. And that shows me that he's having to do a lot of work to force the air out of his lungs. And we can pinpoint his problem to his lower airways, the small airways deep inside his lungs. The computer helps us from the point of view of cost, because the paper for our chart recorder is extremely expensive. So we saved a lot of money by buying the computer instead of more paper. But also, we get a lot more information about each baby because the computer can analyse far more breaths more quickly than we do. To get this information from the paper would take hours and hours of arduous work, and we only did it for a very few babies in the past. Now we get all this additional information from every baby for maybe 5 minutes' work.
These lines on my chest and abdomen have been created by projecting a grid of light. The lines can be photographed using ordinary cameras, and the photographs analysed with a computer so that we can define precisely the shape and movement of the chest and stomach as we breathe or cough. An example of how this technique can be used is in the measurement of the flow of blood through the lungs. In some patients, those with disease of the heart, the flow of blood is very low. Using this technique, we can measure precisely how fast, in fact, the blood is passing through without using invasive methods such as cardiac catheters. What I'm going to do is to take a breath in from a bag of a soluble gas and hold my breath, and we'll see what happens.
No needles involved, just painless patterns of light. Their movement tracks the shrinking chest to show just how much blood is circulating inside. With patterns like these, doctors can even study the breathing of accident victims in intensive care.
Six months ago, analysing these pictures took 2 people a whole month to complete, since all the points had to be calculated by hand. But now, using the digitizing table and the computer, the analysis can be completed in about 20 minutes.
And down at IBM, these same figures are used to reconstruct and study a model of the torso, as if in 3 dimensions.
And we can simulate the breathing in, out, in, out, in, out. That was a normal, healthy adult breathing. Now let us see what this technique gives us when we study a patient with a curvature of the spine. If we look at the breathing pattern on his back, we see that this is primarily a twisting movement. Here we see a patient with a muscular disorder before and after treatment. The benefit of this technique is to allow us to monitor her progress towards recovery.
Doctors do have special ways of seeing. Information technology helps them see the invisible. This infrared camera is linked to a computer. It scans the human body and locates areas of hot and cold. As someone smokes a cigarette, his hands turn cold. A lot of people know that when they have a drink, their face gets hot. Mine does. Now, doctors know that this flushing could be a sign of potential diabetes. Here's a thermal map of my face. It's a bluey-green colour because my skin's at its normal temperature. Well, let's see what a large sherry will do to that. In a few minutes, you'll be able to see if my face lights up, goes red. There you are, just after a few minutes. The camera shows it all. My face has gone red. Doctors can use these thermal imaging techniques to identify conditions like the inflammation caused by arthritis or perhaps thrombosis caused by an operation. And the information can be sent down the line to the computer for accurate measurement. Computer-aided analysis has made these non-invasive imaging techniques both cost-effective and practicable. In fact, they've become an invaluable aid for research, diagnosis, and treatment.
Take a big breath in.
And with computers, we can take a closer look at pictures we've used for years.
This is a conventional chest X-ray, and what we do in a digital system is to transpose the information in that film into a computer memory. And we do it by dividing the picture into small squares or picture elements. And each picture element is assigned a specific value of grayness or shade of gray. The idea is to have the data on this film in digital form in the computer, and this permits us to manipulate the image in a variety of ways. In the region of these squares, we've altered the value of the gray levels, and we can now see details of the spine. Here, each part of the spine is seen quite clearly, and there are the ribs coming off those vertebral bodies, as they're called. If you compare it to the original, where there's very little information, it's almost uniformly white there. The benefits of this system are that we get more information out of the examination, and we can reduce the number of examinations that have to be done in consequence. And this means a reduction in patient dosage and also a saving in money, of course.
So it could save lives, perhaps?
Yes, it could, if it showed you an abnormality which you might otherwise miss. This patient had no symptoms, and yet he's got a cancer in his lung, which you can see by comparing the density of this region here to this region here. This region is too white, and this was caused by a growth in the lung at that point. By altering the values of the gray levels, by manipulating the numbers in the computer, we can produce images which enhance this appearance. Now you see the lesion is standing out much more clearly because it's enhanced in relation to its surround.
And all that simply because it's possible to convert images into numbers, digits. Just as we can convert pictures into numbers, so can we convert the signature of a heartbeat into numbers as well. The ECG, the electrocardiogram.
I'm going to tell the machine something about you now. You just relax and keep perfectly still.
This IBM machine has been designed for places like oil rigs, where there may not be a cardiologist on hand.
You don't take any medication, do you? Thanks.
It will quickly identify a fit man and single out those patients who need to be referred to a specialist.
I'm going to start recording now.
The internal computer converts the ECG waveforms into digital information, then scrutinizes them along guidelines laid down by world experts, homing in on the slightest hint of an abnormality.
Doctors do have special ways of seeing. They can take a small, harmless quantity of a short-lived radioactive material and inject it into the bloodstream. Then, with a special camera, they can watch the actual beating of the heart.
And they can see the patient's heart react under strain. This ice-cold water is as much of a shock to the system as being made to run round the block. On the screen, the computer's comparison between strain and rest gives doctors a rounded picture to help them decide on treatment.
Shall I have patient monitor, please?
And there are other ways of looking at the heart. With 7 views from 7 angles, the computer can construct a picture of the heart as if it had been cut into several slices.
Ernest Cool had heart trouble. In December, he had a pacemaker put in. Over New Year, he died 9 times in one day. His pacemaker was exchanged for this. In his shoulder is the first computerized pacemaker to be implanted in this country. Since then, he hasn't looked back.
Up until very recently, the function of a pacemaker was determined by the physical construction inside the factory. Thus, what the pacemaker could do inside the patient was determined by how the wires were soldered together when the pacemaker was constructed. The software-driven pacemaker is released from that constraint in the sense that the function of the pacemaker is under the control of a language which is stored inside the microprocessor. And this language can be changed so that at any time in the future, even when the pacemaker is implanted, we can use an external computer to communicate with the internal computer and change the language that controls the pacemaker's operation. This is called downloading the software from externally to internally. This pacemaker not only has the ability to alter its pacing function in the sense that how it actually paces the heart can be altered from minute to minute, but it also has the ability to record its activity, both the activity of the pacemaker itself and the activity of the heart over long periods of time.
Oh, great. Otherwise I wouldn't be able to do the things I'm doing now. You know, I'll go to bed at night, I know I'm going to wake up in the morning. Well, I didn't before.
First match of the day, and then the Sweeney.
Richard's disease affects him like a stroke or a car accident could affect any of us. He knows what he wants to say, but he can't talk.
This tape represents a conversation that we've been having in the last half hour or so. The machine is Richard's voice. It's very simple, but it makes a complete world of difference to the way Richard can communicate with his friends. It's just like another very simple thing that makes his life a lot easier, and that is the ability to switch his television on and off.
Thanks to a rediffusion cable system controlled from his bedside.
Information technology is changing the practice of medicine in research, in diagnosis, and in treatment. We've been able to show you some of what's happening, but the really impressive developments are in the future.
By the end of the century, scientists confidently predict that microcircuits are going to work miracles, that they're going to make it possible for the blind to see and the deaf to hear and the paralyzed to walk. Already, there are glimmerings of light for the blind, with a system which is crude as yet, but allows them to distinguish simple shapes and letters through microcircuits connected directly with the brain. And the hope is that the quality of this electronic vision will improve to something like that of a rather snowy black and white television set within 10 years.
People with paralysed backs could have their spines repaired by implanting a chip circuit to link up the motor nerves and hence restore movement. That's all in the future, but it's not that far away. Do you remember penicillin, how that changed the course of medicine? Well, information technology is going to have the same sort of effect. It's up to you, whether you're a patient or a doctor. Remember, information technology is catching. It's catching on fast.
We have got to take particular care that any system which is introduced has actually been evaluated and shown to be of benefit. If that is done, then 3 benefits will accrue. Firstly, there will be much more time for patients to talk to doctors. Secondly, the formal approach to collecting information which is necessary will teach us a great deal about clinical medicine. Thirdly, and possibly most importantly, we will learn a great deal about the efficient use of resources and thereby, I think, get better health for the same cost.